is gonna be a great way to work on end range hip internal rotation strength. We're gonna get on our backs and find our end range of motion or close to it, and then work on trying to get just a little bit more, which is the purpose of a lift off. So you're gonna wanna keep a yoga block nearby. You can do this with a yoga block or not, but I'm gonna show you how to do it with one. We're gonna lay on our backs. You want your hips and knees at about 90 degrees. So we're gonna have our backs here, our feet up on the wall or a bench. Then from there, you can put the yoga block here for a little bit more intensity, or you cannot, it's up to you, but we're gonna do left leg internal rotation. So I'm gonna find my end range internal rotation by walking my foot out. That is going to position my hip into internal rotation. Think about the thigh bone rotating in. From there, I am going to see if I can rotate a little bit more and lift my ankle off the wall. So this is what we are looking for. Light squeeze into the yoga block and this movement. If I can rotate a lot and get my leg off, this is too easy. So you wanna walk out a little bit further and make it more difficult. You should be having to really squeeze the muscles to move just very, very minimal amount. If you're moving several inches, then it's too easy for you. So you should kind of focus on these muscles here, create some tension in the yoga block so I can't pull it out. Squeeze a little bit more, rotate the thigh bone, lift the ankle off, hold for the prescribed amount of time, usually about 3 to 5 seconds, and parachute that foot back down so you're controlling it the whole way. We wanna avoid any groin or closing ankle symptoms. No pinching. If you feel that, play around with your pelvis, tucking or going into the opposite movement. See if that helps, and if that still does not help, you need probably a different position. This is not a good position for you. From there, you're going to rep out the prescribed amount. When we are doing these, we wanna make sure that we are not doing wonky things with our ankle or our knee or bringing our leg up, because that is our knee and ankle moving, and that will no longer be hip movement. So really think about rotating out, squeezing those muscles and getting some good sensations there. If you cramp during this movement, that is just a lack of control. Try to work through the cramping, but don't push into like a full-blown cramp, and eventually you'll see that the cramping will get better.